much, Marty, and hopefully we'll have a chance to get to know each other better at some point. So healthcare was mentioned by a couple of the panelists already as being important in this conversation, and I really want to thank Mary Ann and VerdeXchange for the invitation to be part of this dialogue. As has been alluded to, many of you are familiar with the fact that there's a Mayo Clinic in Minnesota. That's the flagship organization, but in fact, we've got a very secure presence here in Arizona and one that's growing. Perhaps you didn't know that the Mayo Clinic that's here in Arizona is the safest teaching hospital, not only in Arizona, but the safest teaching hospital in the country. A great organization. It's also one of the best hospitals in Arizona by U.S. News, and we're also ranked more than any other major medical center in the United States by the U.S. News and World Report on hospitals. So we're very proud to be in the Valley. We're very proud to be part of this conversation, and I'll share a little bit with you about our journey around sustainability. Let's start with just one example of why we think healthcare is important in this conversation. One sort of overarching is that healthcare uses a lot of resources. We use about 7% of all the energy that's produced in the United States. Operating rooms are intensely energy utilizers. So healthcare has to be part of this conversation. But there's another reason, and I think this maybe is close to all of our hearts and lungs perhaps. I'm actually a pulmonary pathologist, so I'm going to give you an example from lung pathology that I think is relevant. This is the graph or an overview of the impervious surfaces in Maricopa County in 1972. Let's fast forward to 2011. That's what it looks like now. Many of those impervious surfaces are asphalt related to roads, and what drives on roads, cars which produce pollutants and increasing carbon footprint. Why should we care? Well, there's a direct correlation, for example, and again, this is just one example of why I think healthcare needs to be part of this conversation. Asthma, while genetic factors contribute to the development of asthma, did you know that air pollution is documented in attacks of individual patients? The prevalence of asthma, despite the fact that genetics have really remained the same, it increased about 75% since 1980, and it's directly related to how close you live to highways. Well, you might say, okay, well, that's just asthma. What about the average person if I don't have a genetic predisposition? What does that mean for me? Well, here's a study out of Southern California that looks at the relationship between lung function in kids, something we all care very much about, and how close they live to a freeway. And kids living within 500 meters of a freeway have lung function almost 60% less than those who live about 3 times that distance away from a freeway. So you want to die with lungs that look like this because of air pollution and because you live in a highly toxic environment, or do you want to die with lungs that look more like that? Some of that is your own choice, of course. But I think where you live and how we choose to use our initial spaces and the land that we've been given is, of course, part of this conversation as well. So we've been challenging our employees, and I'll show you, this is just one example to a lead-in for our overall program, but as it relates to folks getting to work, we're really trying to help folks think about ways to get to work differently. Bike, run, walk. We are located in 2 areas that don't have access to a lot of good public transportation. But carpooling is something that we encourage. We do give people bus and rail passes complimentary through Mayo. We are encouraging van pools, and if folks decide to do this, it's $25 a month for them to commute to work. And in fact, if you're a driver of a van pool and get a community of folks around you, you get to work free. We also are one of the first hospitals in the Valley to have electric charging stations for vehicles. Sustainability at Mayo is really stewardship of our material resources by eliminating waste, reducing expenses, which also improves the health care of our communities and our patients and our staff. We've tried to look at 5 main areas within our purview. One is energy management. That's pretty simple. Most of you understand that. Waste stream. How can we reuse, recycle in the medical community? And here in part representing the medical community, we partner with Banner on a lot of these issues regarding in the Valley as part of our industry engagement. But We are looking to our suppliers, bringing the supply chain to help us with our waste stream. How can we reduce the amount of packaging that shows up? How can we reuse medical stuff? And in fact, it turns out that some things, the reprocessed items are in fact 100% quality check, whereas, for example, a device that's going through the factory, maybe only 1 every 10 gets checked. So it turns out that the reprocessed items are very well liked by many of our surgeons. Reading the supply chain, already alluded to the built environment. Many of you probably already know what this is. Not only does that refer to building new buildings in a sustainable fashion, but retrofitting the buildings that you already have. How do you decrease the use of air conditioning? How do you change your air handling in such a way that you're able to reduce your environmental footprint? And then industry engagement. Part of why we're here is that we want to be part of the broader dialogue, but we also dialogue with other healthcare organizations about what they're doing in their local environment. And we're very cued in with the VA hospital system here, Banner, Dignity Health, we're involved with all of them. Our grassroots efforts within the Mayo Clinic at sustainability began in about 2009. In 2011, we developed a strategic plan and a committee structure. Mayo is a physician-run organization, so I'm here actually representing the Mayo, Arizona, and the Enterprise Green and Sustainability Committees as the chair of those, but we really work with a broad team of people. In 2012, we developed a scorecard, and I just put up our sustainability scorecard there. We actually hired an ASU intern. We're very cued in with ASU, and ASU has an ad hoc member on our sustainability committee. We're very excited about being partnered with ASU as well. But he helped us develop the sustainability scorecard, which is going to drive our improvement efforts over the next couple of years. We've also signed on with Reimagine Phoenix and taken on as an organization the Mayo Challenge to have our recycling rate be greater than 40% by the year 2020. We're very excited. So our environmental and health care are really highly correlated. We believe that, and it's part of why we want to be at this table. Partnerships, as has already been alluded to by multiple speakers, are vital to innovation and improvement. And I want you to know that Mayo Clinic in Arizona is committed to spearheading sustainability solutions in the healthcare sector in the Southwest. Thank you very much, Mary Ann, for allowing us